On Sunday, March 21, 2010, the House of Representatives made history by passing Barack Obama's Patient Protection and Affordable Care Act, bringing a national health care program to the United States for the first time. Although now, only 2 years later, the Supreme Court has come together and now is forced to decide whether or not a national health care program goes against the foundation that our forefathers have built this country on. For the first time, this government seems to be moving closer to socialism because of the Democratic Party. Although the Supreme Court decision is not expected until June 2012, hopefully they will make the right decision and repeal this bill. A large problem regarding the bill is the lack of Americans properly informed. Part of the Patient Protection and Affordable Care Act already applies to all Americans, such as insurance programs must allow coverage for children until the age of 26 and must spend at least 80% of their premium on their health care or give a refund. People who fall into the donut hole also are allowed a $250 rebate that at one time to spend on medicine. Small businesses are allowed a tax write-off if they provide medical insurance to their employees. Although soon to come, if the Supreme Court does not repeal this bill, will be medical payroll taxes will increase for single citizens who make more than $200,000 per year and couples who earn more than $250,000 per year in 2013. Health care coverage will be required for every U.S. citizen and legal resident in 2014. If they do not meet this requirement, there will be a fine distributed starting at $95 and reaching up to $695 in 2016. Then every year after that, the fines will be adjusted according to the individual's income. By forcing the states to accept federal mandated health care programs is a violation of the state rights. Although there are benefits to this bill, more people will have access to insurance than ever before in the United States. The number of insured Americans rise to 50.7 million in 2010, making this a serious issue. A quarter of the population ages 19 to 64 experienced a gap in health insurance in 2011, and 69% of those without coverage for a year or more, according to the study released Thursday by the nonprofit Commonwealth Fund. The Congressional Budget Office is reporting that the new health care law will decrease the number of uninsured in 2019 by 32 million. However, that does not mean that there will be a universal coverage. 23 million Americans will remain without coverage, including illegal immigrants. Improved health insurance plans will also occur if this bill is not repealed. All insurance companies now are required to offer preventative services, and children with health issues are no longer allowed to be denied on any kind of health insurance plan. But while there are positives involved in the Obamacare program, there are many negatives as well, such as the fines that will be implemented to anyone who does not have insurance after 2013. While it was nearly a century in the making, the Democratic Party has finally forced a mandatory health care policy to all Americans, and if we refuse, there will be these fines will be implemented. More than half of all Americans declared bankruptcy due to medical-related issues. But how is forcing expensive medical insurance or fines any better? This bill will cause a large shortage in healthcare physicians. The Association of American Medical Colleges projects that the nationwide physician shortage will balloon to 62,900 doctors in 5 years and 91,500 in 2020. 56% of doctors said that the new law will diminish the quality of care that they can provide for their patients. So why would we implement it? Why did it ever become a law? Clearly the negatives outweigh the positives. Obamacare is a bill intended to expand insurance coverage by expanding the government, rather than just making the current health insurance market more sensitive to the American needs. Moreover, certain provisions of the new laws will make obtaining health insurance less desirable by increasing costs, causing even more Americans to drop or lose coverage. President Obama and congressional leaders promised the American people health care reform that would increase access to health care, while simultaneously creating greater choices and competitive and curbing increasing health expenditures, including lawmakers passed into law a top-down, heavy-handed government approach that will increase coverages at the expense of the other two objectives, instead of making limited choices and increasing health spending.